this is gonna be a very kind of hopefully concise talk about what is behavioral medicine. And just to kind of give you, just to reiterate what Carrie just shared, this is part when we were kind of creating and writing up a proposal to support a checkup as a center. We tried to think about what makes checkup different, right, in terms of health equity and in terms of addressing disparities. And I was just having this conversation earlier today because obviously at Wayne State University, there are a number of faculty and programs and centers that address disparities of different types, whether it be racial, ethnic, socioeconomic, and so on, age disparities in our area. So what might make what we're doing somewhat different from what's already happening? And I came up with these 5 different points. Behavioral medicine focus, application of a social ecological model, public health critical race praxis, community-based participatory research approach, and transdisciplinary team science. So I along with other folks will be kind of presenting on these topics over the next few meetings, like I said, so that we have shared language, we understand what that means. So today I'm going to talk about what do we mean by behavioral medicine. And actually, I know, Lisa, you mentioned that this month is Behavioral Health Month, but that's one of my first points. Oh, but first of all, yeah, so first, before I get into that, what is behavioral medicine? Why is it so important that we say behavioral medicine research, right? So, because a lot of times, especially at a university setting, especially in a university setting like Wayne State, where there's like a large medical school and there's a lot of medical research going on, it's kind of really, a lot of times people think about what we call basic science, right? Or bench science, bench research, right? What is bench research and basic science? It seeks to understand living systems and life processes, but on a very kind of granular level. Usually includes, it's like focusing on things happening at the molecular level or the cellular level, right? It's what we kind of all associate with, the bench, like what's going on in laboratories, right? The wet labs with microscopes and folks with a lot of technology, trying to understand, again, the basic processes of, of life and organisms. So it includes scientific disciplines like biochemistry, microbiology, physiology, pharmacology, just to name a few. And it's again, we associate that with like a certain type of laboratory work with cell cultures or animal studies or different types of physiological experiments, right? So I wanted to be clear that this is not, bench science and basic science can be, I think, I see a lot of opportunities for integrating that into the work of checkup, but that is not the primary in conceptualizing this whole, in conceptualizing the center. That is not the main thrust, right? It's behavioral medicine research. And one of the things I want to say, going back to what I was saying, so behavioral medicine is not the same thing as behavioral health, which is around mental health services or mental health research, right? And I know there are a lot of behavioral medicine researchers on this call, and there might be some behavioral medicine researchers on the call who don't realize that's what they do, but that's, you're a part of it as well. So definition of behavioral medicine, it's a field of research that involves multiple disciplines. I'm going to give you a long list of who that can include. It's concerned with the development and integration of biomedical and behavioral knowledge that's relevant to physical health and to disease. It's concerned with applying that knowledge to etiology, the causes of disease, prevention, health promotion, diagnosis, treatment, and other areas of care. And what is key here is that it draws largely upon behavioral and social science rather than biological sciences or some of the sciences I just talked about. Behavioral and social science in order to address the complex interplay and relationships between biology, people's social world, people's environment, right? And it can include, we can be looking kind of within the individual, and that can include even on the biological level and physiological processes like genetics and neurobiology, but also psychological level, emotion, perception, cognition, right? But also we can look at processes outside the individual, like our environment, social relationships, social factors, policy, right? So behavioral medicine is really, it's broad. And multiple disciplines, like I said, it's multidisciplinary. And these are just some examples of, kind of professions that are associated or can be associated with behavioral medicine. So I'm a psychologist, I'm a clinical psychologist, and I do this type of research. There are, nursing, health educators, physicians, certainly, and epidemiologists, statisticians, nutritionists, sociologists. I mean, there's, again, a lot of people can be involved in the work, and they're involved to the extent that the research, again, is kind of really driven and really involves behavioral and social science and looking at that in relationship to a health outcome. Okay, so what else? And here's some just areas of behavioral medicine research and intervention, right? And again, across the board, right? And this is not limited. There's probably far more than this. So, but these are definitely some areas, ranging from certain topics you've seen there, like adolescent health, children's health, women's health, disparities and equity. So there are these kind of broad areas or categories of behavioral medicine research, and then there are specific topics like, anxiety, arthritis, rehabilitation, diabetes, depression. So again, really broad. And again, with a lot of these, it's not like these are always these kind of discrete separate categories, right? You can look across, there's a lot of research across these different areas as well, right? Okay, so, and I want to say here that for checkup, in behavioral medicine, I think for checkup, intervention is key, right? Because we can look at a lot of these, a lot of different topics and do work and studies that look at the relationships between A and B, but we want to kind of also think about interventions because interventions help to create change, right? So behavioral medicine interventions are typically organized efforts to promote conditions or behaviors that can improve health. And they can target individuals, dyads, such as married couples or romantic pairs, families, broader social networks, whether it be within, a neighborhood or within a church, institutions like churches, schools, hospitals, entire communities and neighborhoods. And intervention can also be on the level of policy and legislation, right? And we just talked, I know Lisa was speaking before, about thinking about social needs, right, and how that affects health outcomes. That's connected to a larger issue, right, of structural issues, right? How does policy and how do resources in environments, physical environments, kind of, or the lack of resources in physical environments lead to, increased social needs that can have a deleterious effect on health. So again, interventions can be pretty broad as well. So I know there's a lot going on here. I wanted to show you, I just point out, this is from one of the professional organizations I belong to is called the Society of Behavioral Medicine. And there's several societies that really focus on it. And there's a great conference and there are people from all different backgrounds, all different disciplines, looking at all different topics. It's a fantastic meeting to go to because you can go more in depth in your own topic or you can learn a lot that's new. So they have a nice timeline of behavioral medicine here, but I just circled some things that I think are worth kind of paying attention to kind of for those who are less familiar to understand kind of what this means and what this encompasses. So it starts back all the way to 1955, over there up here on the upper left, and it talks about the first behavioral research grant that was awarded by the National Heart Institute to look at psychological characteristics of individuals with hypertension and coronary heart disease, right? So they're connecting, again, psychological characteristics, which has to do with, can be range from attitudes or personality characteristics even. I know there's a big, there has been a lot of research like between hostility and anger and cardiovascular disease, and looking at that in relation to a physiological outcome, hypertension, right? I want to jump down here all the way to the bottom to 1956, the publication of The Stress of Life, just speaking of that. And it's interesting because I haven't thought about this in a long time. I hadn't tell you. When I was a graduate student, I did my dissertation actually was on cardiovascular disease and hypertension and how racial identity affects hypertension and what we call cardiovascular reactivity. How reactive are you to stressful events? And The Stress of Life is just really kind of a classic work because it talks about, it's not only about the stressors that you experience, it's how stress is about your perception of stress and how you cope with stress, right? So that was a really groundbreaking work back in the day. 1974, right here, a publication by Friedman and Rosenman, publication on type A behavior in your heart. So again, looking at how behavior and personality characteristics affect health. Going to jump over here to 1984. This is when the first multi-site clinical investigation of behavioral treatments, again, now thinking about interventions, were funded to look at hypertension interventions by the National Heart, Lung, and Blood Institute. 1996, going to jump over here, smoking cessation guidelines were promoted, and behavioral medicine research helped to undergird that. And then 2002, a landmark diabetes prevention program showed that lifestyle interventions reduced risk for diabetes, right? To a greater extent than medication. So that just gives you like an overview over time about kind of how, you can see how it's kind of developed over time and some of the topics that are important or are part of behavioral medicine research. And then finally, I'll just share here just some selected, just to kind of continue that theme, some selected articles from one of the journals, a major journal of behavioral medicine research, the Annals of Behavioral Medicine, which is actually connected to the organization I just mentioned, the Society of Behavioral Medicine. And just pick some titles from 2021 and 2022, so you can see, again, just a huge range and just really innovation actually that's even happening with some of this work. So what strategy is better for promoting COVID-19 vaccination? That comes from this month's issue actually. A comparison between gain framed, loss framed, and altruistic messages, right? So, gain framed messages tended to focus on like, what you have to gain. What are the benefits of doing something? Loss framed messages tend to be kind of fear-based or what you lose by doing something. And an altruistic message would be kind of thinking about doing it for the greater good. This is a huge area, like in my area, cancer, and thinking about cancer screening, sometimes, and it's important because sometimes when I talk with different, particularly with community members and talk about what kind of messages should we give to people to get them to change their health, they're like, oh, scare them, tell them, make them, let them know, like, that what can happen if they don't get screened or if they don't get care. Well, that's a loss frame message, and that doesn't necessarily work. This is the kind of research to show what kind of messages do have the greatest impact. Second here, the role of yoga and its plausible mechanism in the mitigation of DNA damage in type 2 diabetes and a randomized trial. And I picked this one because it shows the connection between physical activity, yoga, and actually how it affects people on the cellular level, right? So again, behavioral medicine can be broad. Gender affirmation as a source of resilience for addressing stigmatizing healthcare experiences of transgender youth of color. There's a lot going on in that study, a lot of populations, but again, looking at, so this kind of shows how is an example of research that is involving kind of healthcare delivery, establishing the effectiveness of a community-based physical activity program for fathers and daughters. So again, this work doesn't necessarily have to happen in a healthcare setting. It certainly is very much happening in communities and thinking about how do we affect behavior outside of the healthcare setting and outside of maybe physician and provide patient communication and relationship. This one I thought was interesting to have the cardiovascular cost of silence, relationships between self-silencing and carotid atherosclerosis in midlife women. I might go back to that one. I was just picking titles, but that's, again, thinking about, here we can think about gender roles, right? And social roles and how that affects health and health outcomes. And lastly here, social contact frequency. So thinking about people's social support, their social networks, and pain among older adults with HIV. And ecological momentary assessment study. So that ecological momentary assessment really represents, so there are ways of giving people tools, and we can do it now more with technology, right? Through, even through our phones, or through digital devices, where throughout the day, they can ask people to complete assessments, right? And so throughout the day, you're answering questions about your social contacts, your social relationships, and then researchers will take that data and then connect it to maybe some physiological processes as well. Because sometimes at the same time when they're asking about your social context, they're also asking you about kind of your experience of pain, right? And your pain, kind of pain severity, even. So they can kind of connect those things. What's going on during your day and how's that affecting, again, your experience of pain? So that's all I have. The key, hold on. So just some key points to take away. Behavioral medicine research is multidisciplinary, involves a range of folks and disciplines and partners, and addresses a wide range of diseases and conditions. And there are many approaches to this research, right? Because, I know we have some nursing folks on the call. The research generally has pretty consistent methods across the board in terms of like using like the scientific method, but some of the techniques and strategies used by people who are nursing researchers are different from what I might use as a researcher in psychology, might be different from someone in social work or from epidemiology. So the different approaches. It's rooted in behavioral and social sciences, so we can understand how processes within the person and processes within the person's physical and social environment affect health, and behavioral medicine, finally, can inform different types of interventions to improve health. That's it.